Kia ora, Acupuncture New Zealand practitioners. I'm here today to share with you the Battlefield Acupuncture and the Penta Balance Method auricular therapy module. This is a revision and training module for the Veteran Certification Project. First, I want to speak just a little bit about who I am and the project. So I'm Robin Kerr, and I'm the current president of Acupuncture New Zealand. We've been supporting the development of a veterans certification project, and this has come from the work of Mark Campaign, who's a facilitator and leader, creating an inter-organizational network of agencies, which include our organization to support veterans and their families. It stemmed from the work of the mental health acupuncturist group in Wellington, and they've been doing a small pilot project. Concurrently, we've also been working with Professor David McBride and Otago University, and there will be the study going on. So this module is part of the training module for those who would like to participate in the program this year of delivery of acupuncture to veterans for chronic pain. So this is actually quite an extensive project. It's multi-leveled. It involves collaboration with many different organizations who are there to support veterans and their families. And this is a model of working which has been seen to be transformational in its ability to create much more efficiently programs that serve the needs of communities and can develop much quicker than when one organization is leading or heading them. So this is a step in a new direction where we'll see more work that happens based upon networks. So today we have Pai Barales-Bird, who's going to present to us all. And I'd like to introduce Pai. Pai's been in practice for over 20 years, and she's been specializing in trauma and the developmental processes of integrated holistic health. Her experience stems from working in America with addictions, both at Yale University and the Lincoln Hospital, as well as walk-in clinics post the 9/11 terrorist attacks in New York. With the support of Acupuncture New Zealand and Acupuncture Without Borders, Pai led trauma stress relief clinics post the Christchurch and Kaikoura earthquakes. She continues her study and mentorship with Lorne Jarrett, author to several Chinese medical texts. Pai resides in Kaikoura with her husband, Brendan, their daughter, Leela, and their little dog, Spot. So I'd like to welcome Pai, and I'll hand it over now, Pai. Thank you.
Thanks, Robin. Thank you, Acupuncture New Zealand, for allowing me to be part of this amazing project. And so let's just jump straight into it. The Veterans Project. So this part is your theory and protocol. I do need to begin first with a trigger warning. We can only bring those we treat and engage with as far as we've taken ourselves. The Veterans Project theory, procedures and protocols can trigger past events or traumas you may have experienced. To honor those moments, please contact Acupuncture New Zealand and/or your support group person if you find yourself in any difficulty during this training. So just a couple figures, the New Zealand Defence Force. There are 33,000 veterans having served in Aotearoa, New Zealand. Of 1,779 surveyed by Professor David McBride in Otago, 24% of them are experiencing extreme pain. It is estimated that 8,050 veterans in Aotearoa, New Zealand, are suffering extreme pain. Otago University has estimated that a third suffers from post-traumatic stress disorder. Chronic pain and PTSD impacts intergenerationally. What's so special about this project is that it also includes the families of those who have served. Trauma and shock, the Western medical definition, we'll start there first. According to the American Psychological Association, trauma is an emotional response to a terrible event like an accident, rape, or natural disaster. Immediately after the event, shock and denial are typical. Longer term reactions include unpredictable emotions, flashbacks, strained relationships, and even physical symptoms like headaches or nausea. While these feelings are normal, some people have difficulty moving on with their lives. Post-traumatic stress disorder, PTSD. This is defined by mentalhealth.org.nz. Post-traumatic stress disorder, PTSD, is a psychological reaction to experiencing or witnessing a significantly stressful, traumatic, or shocking event. With respect to the Veterans Project, any situation where there was a risk of being killed or injured, seeing others killed or injured, or sometimes even hearing about such things can result in PTSD. Some events are more likely than others to cause PTSD. Symptoms. People with PTSD may be constantly watchful or jumpy. Their sleep is often disturbed and they may feel irritable and angry with themselves and others. Memory, concentration, and decision-making are often affected. You may try to avoid any situations, people, or events that remind you of the trauma. You may be unable to feel emotions, even for the people you love or care for. You may feel detached from others and may lose interest in things you once enjoyed. The unpleasant feelings associated with the trauma keep coming back along with images, memories, and intrusive thoughts about the event. There may be nightmares or bad dreams. In the daytime, you may feel that it's all happening again, or have brief but vivid memories or flashbacks. Trauma and shock and the Eastern medical crossover. So alongside the Western medical definition of trauma and shock, there's also an energetic translation as well. So the body's meridians can become blocked or congested. The discernment on which systems are most affected happens upon your intake. The 7 emotions, pathologies, and pattern diagnosis are to be discerned. So for example, with the fire element, the anxiety and panic that may be part of the syndrome affects primarily the heart, pericardium, small intestine systems. With the earth element, the chronic worry and ruminating of the events affect the middle jowl, the spleen, stomach system, as this is a place of overthinking and worry. So just as much as you eat of food and sustenance, you also eat and digest your thoughts as well. Metal, lung and large intestine, grief and loss reside here, as well as one's sense of value. Water, shock, intense fear affects the kidney and urinary bladder systems. The wood element, anger, mainly associated with liver, but the deep, seething, quiet anger is often associated with gallbladder. So this presentation covers 2 auricular modalities, battlefield acupuncture, BFA, and the Penta balance method, PBM. Please choose the most appropriate method at the time of treatment. Do not use both in the same session. And also note, do not use the BFA in one ear and PBM in the other ear. Just stick with one modality for both ears. These modalities can be used with extra distal points that support the related meridians and or pattern diagnosis you may have found in your intake. It is advised to use the grounding distal points with these treatments as well. The basic theory behind auricular acupuncture: the entire body and its organs are represented upon the anatomy of the ear. Like an upside down human fetus can be seen upon the entirety of the ear. So it is a microsystem. One of my favorite books for ear acupuncture is The Ear Gateway to Balancing the Body, a modern guide to ear acupuncture by author Mario Weishu. What are you going to need? So you'll need a clean field. You'll need Sharps container, an ear probe. It's not necessary, but it does help. Cotton balls, alcohol pads, and needles. I like to use the 0.16 by 15. Possible side effects, battlefield acupuncture, and the Penta balance method. Although these specific methods are considered a safe form of treatment, even safe procedures carry risks. Feeling of euphoric, lightheadedness, discomfort or pain at needled sites, bleeding or bruising, the ear is quite vascular, inflammation and possible infection at needled site, dizziness, nausea, and fainting. Please note, when you're working, and if a patient does have any adverse effects, please include that in your patient notes for that day or for that treatment. Great, so let's get into the battlefield acupuncture. So as you can see here, there is an order. There are 5 points, and it starts with your cingulate gyrus, your thalamus, omega-2, point 0, and Shen Men. It was developed by Richard C. Niemtsoy, and we're going to go through the explanation of how this works. Battlefield acupuncture. So Dr. Richard C. Niemtsoy was the first full-time acupuncturist in the armed forces as an Air Force physician and a guest of the United States Naval Medical Center in San Diego. He went on to teach for Joseph M. Helms, MD, medical acupuncture course and practicing at the Walter Reed Army Hospital. The battlefield methodology favors the processing and the modulation of pain in the central nervous system, involving the hypothalamus, thalamus, cingulate gyrus, and cerebral cortex structures. Developed in 2001, Dr. Niemtsoy was researching a more efficient auricular therapy system for rapid pain relief. He was intrigued by the cingulate gyrus and thalamus area for pain processing alongside omega-2, Shen Men, and point 0, as he had stated in his story, which was published. He said, voila, this was all coming together for him in August 2001. When final sequencing of the points were established, this was around the time of the 9/11 terrorist attacks in New York City. And Dr. Niemtsoy decided to name this technique battlefield acupuncture. Managing treatment. You may want to keep a patient rating scale of pain symptoms prior to treatment and after treatment. It is advised to have the patient jot down notes post-treatment of symptoms either abating or worsening. Always check in with your patient after each insertion of needles. If there is lightheadedness, allow the patient to lie down and remove the needles. If your patient is seated, just remove the needles and then just stay with them and check in with them to make sure all symptoms have resolved. Have them sit up, offer them some water. Euphoric symptoms can be experienced as well, and have these resolved before they leave the office, especially if you're concerned about their travel back to work or home. In the words of Dr. Niemtsoy, in the early years, BFA truly started to gain momentum. Joseph M. Helms, MD, had the foresight to take me on, and I taught BFA at his 300-hour medical acupuncture course. I do not think anyone expected interest to last. However, during the height of the Iraq and Afghanistan wars, as wounded warriors arrived in large numbers to the Walter Reed Army Hospital, BFA began to be noticed quite a bit. Western medicine was great for helping these patients, but it had its failures. I introduced BFA at the bedside of these heroic patients, and the demands from both patients, families, and physicians skyrocketed. Teaching BFA suddenly became a high priority. Clean needle technique and safety for both the BFA and PBM modalities. Using aseptic technique, proper hand washing, personal protective equipment, and ear cleansing with alcohol swab. Note, appropriate PPE is mandatory in times of COVID. Battlefield acupuncture, the protocol. So your patient is in a seated position. Once the needles are inserted, Ask the patient to move the set area that is experiencing pain or to walk around a bit. Then add your distal grounding points can be inserted at that time. Treatment time varies depending upon constitution of patient and response to treatment. Remove the needles in the order that they have gone in. I'm also just going to emphasize something here. When you put your BFA in, you have the patient move that particular area of pain or concern, or you can have them walk around, have them come back, sit down or lie down, and then you do your constitutional points. You do not do constitutional points as they're walking around, okay? Sequence of battlefield acupuncture. In this order, cingulate gyrus, thalamus, omega 2, point 0, and Shen Men. So we're going to go into a video of the demonstration of how to needle these points. Okay, first things first, you're going to want to use an alcohol swab, and you're going to want to clean the area that you will be needling. We are starting with the battlefield acupuncture protocol. I will be using the butt end of the needle first to show you the location. You start with number 1, cingulate gyrus, which is located at the front of the intratracheal notch, which is located right here. And I like to press the point first before we needle it. It just allows the body to know that's where we're going. Ask your patient to take a breath in, needle the point, and then let it go. Touch base with your patient, ask them how they're feeling. Feel good. Okay. Your next point in the protocol is the thalamus, and it's located on the interior aspect of the antitragus. The best way to locate this would be to pull the lobe down, and you're going to come on to the inside. I'm just using the butt to stimulate the point. On the inside of the antitragus. And now we're going to needle it. Take a breath in and down. And that's point number 2. Point number 3 is the omega 2 point, which is found on the helix of the ear. The best way to find this would be, this is your antihelix on the interior aspect of the ear. On the interior part of the antihelix, you follow it up, follow this all the way up, and your point's going to be right on top of the helix there. I'm just stimulating the point with the butt of the needle first. Turn it around, take a deep breath. Point number 3. Point number 4 in the protocol is point 0. Which is found in the center of the concha, which is this part of the ear right in here. Okay, we'll use the butt first to stimulate the point. Just mark where we're going to go. Breath in and out. There you go. Touch base with your patient. How are you feeling?
Very good, thank you.
If at any stage your patient feels a bit lightheaded, please have them lie down on the table. Take the points out and just let them rest for a bit. If not, you can keep going ahead. The next point in our protocol is Shen Men. So Shen Men is found on the triangular fossa on the inside of the antihelix. Okay, this is your triangular fossa right in here. And Shen Men is literally found right at the base there. Breath in and out. And that is your battlefield protocol. Great. Thank you, Brennan, for being our model. So we'll start with the cingulate gyrus, located at the front of the intratracheal notch. The cingulate gyrus lies on the medial aspect of the cerebral hemisphere. It forms a major part of the limbic system, which has functions in emotions and behavior. The cingulate gyrus is an arc-shaped convolution situated just above the corpus callosum. The frontal portion is termed the anterior cingulate gyrus or the cortex. So the functions: coordinates sensory input with emotions, emotional responses to pain, regulates aggressive behavior, communication, maternal bonding, language expression, and decision making. The thalamus is found on the inner aspect of the antitragus. The thalamus serves as a main relay station for the brain. Motor pathways, limbic pathways, and sensory pathways, besides olfaction, all pass through this central structure. It's kind of like the Grand Central Station. Omega 2, located on the helix, in line with the posterior border of the antihelix. Omega 2. Omega auricular points are the mastery points of the 3 embryologic tissues that develop within utero. Omega 2 is the master point of the mesoderm, the musculoskeletal and vascular tissues. Emotional and psychological aspects are the ability to communicate with others, and negatively, the tendencies of domination, aggression, and overpowerment. Point 0 brings the entire body into balance, balances energy, brain activity, and hormones. By combining this point with other auricular points, it supports their actions. It can offer energy as well as having a relaxing effect. It promotes the downward flow of stomach qi and aids in the easement of nausea, vomiting, and hiccups. Shenmen. Shenmen is located within the lower border of the triangular fossa of the antihelix. Shenmen, this point alleviates anxiety, controls nervousness, has a general relaxing effect, and helps to bring the spirit heart, the heart energetics, into balance for the conscious self. Negative emotions would be like impatience, mood swings, cruelty, and the positive emotions would be joy, calm, and honor. So this is just a short review video of these points in their order. I'll press play now. So your cingulate gyrus. So pull the lobe down. That's the easiest way to get to the thalamus because it's on the inside. Omega 2. Point 0. And then Shenmen. So just take note, everyone's ears are different. They all have different formations. They may have extra folds. You may need to pull here to get to the cingulate gyrus on this ear. We do have a lot of rugby players in New Zealand, which end up with cauliflower ears. So you might have some restrictions in some areas. It's just go by anatomical landmarks and do the best you can to find the appropriate spots for these points, okay? So now we move into the Penta balance method. The Penta balance method are comprised of 5 points: the sympathetic, Shenmen, kidney, liver, and lung. And just note, with the lung point on the right lobe, the lung point is located above the heart. And on the left lobe, the lung point is located below the heart. So you'll need to find where the heart point is first in order to find your lung point. And then once those points are in, your distal treatments could be tailored to constitutional presentation and or grounding points. Finding one's balance. So the Penta balance method is a set of 5 auricular points with the possible use of distal body points for an integral groundwork of healing. These points have been used in corrections, drug and alcohol centers, as well as trauma stress relief centers post-natural disasters. The Penta balance method was influenced by mainly Dr. Wen. Dr. Wen is one of the first to propose what is now known as the NADA protocol, the National Acupuncture Detoxification Association protocol. Through his work, recognizing certain auricular points had a very strong effect in mitigating addictive cravings. Dr. Wen's work was quite inspirational in detox and withdrawal and was picked up by the Lincoln Recovery Center in the Bronx, New York in the mid-1970s, and it was called the Lincoln Detox Protocol. It was then after, in 1985, that Dr. Michael Smith, the director of the Lincoln Recovery Center at that time, incorporated the work and then deemed it the NADA protocol. NADA today is a standardized acu-detox protocol with its own training and membership. The Penta balance method is a combination of these 5 points integrated with the use of distal constitutional / grounding points. The PBM method. Okay, so your patient's in a seated position, insert the needles in prescribed order, use distal constitutional points added and/or grounding points. Treatment time varies depending upon the constitution of the patient and response to treatment. Remove the needles in the order that they have gone in. Penta balance method demonstration. So I will press play. Okay, so this brings us into the Penta balance method. Please first clean the ear with alcohol swab. We're going to start with our first point, which is the sympathetic point. The sympathetic point is located, if you follow the inferior border of the antihelix, which is this right here, and this is the inferior border. Follow this underneath the helix fold, and your point is located right in there. Breath in. Very good. Always check in with your patient. How are you doing? Good, thank you. Very good. Our next point is Shen Men, and Shen Men is located in the triangular fossa, which is this right here. With this antihelix, everyone's ears are different. This antihelix is a bit thicker here. So we are going to go to the lower border, which the point is located right there. Breath in. Good. Our third point in this method is kidney. And kidney is located directly under Shen Men. You follow Shen Men and you go over the inferior border of the antihelix. And it's found tucked underneath here, in direct line with Shen Men. Take a breath in. Very good. The fourth point in our method is the liver. And the liver point is found by following the helix past the crux helix here, in line with the crux helix to the border of the antihelix. Breath in. Very good. Our last point is lung. And lung has 2 locations. On the right lobe, the lung is located above the heart point. On the left lobe, the lung is located below the heart point. So you must find the heart point first. The heart point is located in the center of the auditory canal, in line with the crux helix. This is your crux helix, the center of the auditory canal. That is your heart point. So on this lobe, the lung point is located right above the heart. Breath in. And that is your Penta balance method. Okay, so this brings, great. So let's talk about these points. And thank you for our ear model, Craig, for lending us his ear. So sympathetic, located in line with the lower border of the antihelix on the inside of the helix fold. So this is where an ear probe comes in handy so that you can actually pull the helix away so you can get into that point. Sympathetic, autonomic, part of the autonomic nervous system. This point alleviates stress in the autonomic nervous system. It is your flight or fight response. So this basic response to perceived danger evokes great anxiety and translates into a powerful stress response in the mind, nervous system, and organs of the body. So negative emotions associated with this is anxiety, and the positive emotion is calmness. The second point is Shenmen, located within the lower border of the triangular fossa of the antihelix. Shenmen spirit gate. This point alleviates anxiety, controls nervousness, has a general relaxing effect, and helps to bring the spirit heart or the heart energetics into balance for the conscious self. Negative emotions are impatience, mood swings, cruelty. Positive emotions are joy, calm, and honor. Point 3, kidney. Located directly below and in line with Shenmen. From Shenmen, you go over the inferior border of the antihelix, and the point is tucked in at the border between the antihelix and the symbicontia. Kidney, essential energy, yin and yang source. This point alleviates toxicity in the kidneys from chemical use. It purifies the blood, strengthens the nervous system, calms fears, and removes insecurities. As the source of yin and yang energy, it is related to the life force and longevity. Negative emotions are fear, paranoia, anguish, and positive emotions are awareness and gentleness. 4, liver. Follow the line of the helix down to the crux of the helix, and you continue until you hit the border of the antihelix. Liver point. So emotional balance rules the flow of qi. This point alleviates toxicity in the blood in conjunction with the kidney. Balance of liver energy creates emotional balance for relaxation and confidence. Stabilizes impulsive behavior and mood swings. Negative emotions are anger, rage, depression. Positive emotions are kindness and balance. And your lung, point number 5. Lung has 2 positions. So the left ear in this diagram shown is located below the heart point. So where that white arrow is. So you locate the heart point first. So heart is located in the center between the auditory canal and in line with the crux helix. On the right lobe, the lung is located above the heart point. On the left lobe, it's below the heart point. And the way I remember it is left lower, so L and L. Lung, life force, balance, rules qi. This point alleviates toxicity in the immune system, respiration, and skin function, promotes physical balance and the expression of feelings, especially sadness and grief, promotes relaxation. This is a nourishing organ involved in the very balance of the life force itself. Negative emotions are grief and sadness. Positive emotions are courage and righteousness. So we'll move into our video of the Penta balance method. So you pull away the helix and you'll find your point right in there. And then we're moving into Shenmen. Kidney, liver, so you're going to find your heart point first because we're going to need a lung. And we're on the left ear, so it's below the heart point. Fantastic. The use of constitutional and grounding points. So following the insertion of the auricular points to support, now you can use your constitutional and grounding points. Keep it simple. Less is more. The aim is balance. Examples of grounding points are like liver 3, Sanjiao 5, stomach 36, kidney 3, gallbladder 34. In your intake, for example, if you may have someone who's experiencing more heart palpitations with anxiety, you may use the 5 auricular points and then may add pericardium 5 or pericardium 6 for that matter, or heart 7 to help balance out the heart energies. Please keep in mind that auricular points are quite powerful points because they're that much closer to the brain. So they're going to have that much of a strong effect. So less is more. Response to treatment with battlefield acupuncture and the Penta balance method. Everyone responds to acupuncture differently. Some may experience immediate relief of symptoms. Some may experience a delayed response. Some may need several treatments before experiencing a relief. It's important to move at the pace of the individual. Battlefield acupuncture versus the Penta balance method. So as a practitioner, you have tools to use. One could see the battlefield acupuncture more for the physical aspect of pain that our veterans come in with. The body physically may be holding on to the event 20, 30, 50 years ago through the muscle cell memory. One could see the Penta balance method as a more somatic emotional treatment as it taps into that flight or fight mode and relaxes that trigger system. Many whom suffer from PTSD self-medicate and may also have underlying substance abuse to mitigate their albeit physical, emotional, or spiritual pains. So detoxing from substance may in fact be part of why they come in to see you. Inability to express an empathy. Trauma, shock, post-traumatic stress disorder can freeze the tongue. And what I mean by that is the tongue in TCM is the root of the heart. There will be times where one may come in and cannot express the horror, but wishes to be free of it. This requires empathy on your part as the practitioner. Witness without words, and you provide your treatment through your tools and allow silence to be the medicine working with the auricular points. Your patient here may find it more helpful to write things down in between treatments so they can begin stepping out of the past that has been shadowing them. Remember, it is an honor to treat the life force in any individual. It is an honor to receive these protocols handed down from masters and the intuition of great physicians. It's an honor to treat heroes. It is an honor to recognize the life force divinity within the person in front of you. No matter how broken, hurt, lost they may be, life force divinity is in there. It is an honor to be able to bridge the West and the East for the fulfillment of the whole being. And thank you so much, as it's an honor to provide this information to you. So I'm now going to pass this over to Robin.
Lovely. Thank you very much, Pi. Thank you very much for that, Pi. It's really well put together and explained. So to complete this module for the Veteran Certificate, we're asking that you answer the following 5 questions correctly, and these I'll go through now, and also to email these to the register. Also, to provide confidence and to support the practitioners by ensuring that their point selections are correct and correctly identified and needled correctly, and to provide confidence to the other providers and partners in this project. We ask that you work together with other practitioners or with family to demonstrate that you know where the points are and that you can needle them by photographing your insertion. And these you can email with your questions to Acupuncture New Zealand. And that will provide you with the continuing professional development hours, as well as completing the module for the certification, for the RSA certification and Otago program. So first question, name the 5 points in order of insertion used in battlefield acupuncture. Which of the 2 methods, battlefield acupuncture or Penta balance method, would you select to use for chronic pain? Name the 5 points, again, in order of insertion used in the Penta balance method. Very important one. Name 3 adverse effects that could occur when needling an ear. And I really would like that you review this and to ensure that you know how to manage any situations that occur. Which of the methods would you select to support emotional trauma or reducing the impact of addiction? So if you can email your 5 answers and the photographs to the register at office@acupuncture.org.nz, that will complete this whole module. And this is available for you to review at any time. Also, the slides will be available on our website. So we look forward to the next steps in this process. Thank you so much for your participation and wishing you all the best. Thank you.